The prevalence of medical radiation, its risks, and efforts to control those risks have never been so apparent. 2 years ago, Europe adopted directives known as the Euratom to establish basic safety standards in the medical community to protect against dangers posed by ionizing radiation. 3 years from now, laws are slated to take effect across Europe to further regulate the exposure of patients to this radiation. At a Bayer-sponsored symposium Wednesday, March 4th, attendees of the European Congress of Radiology in Vienna listened to speakers address differing aspects of the debate about radiation. Professor Dr. Joachim Ernst Wildberger of the Maastricht University Medical Center in the Netherlands chaired the panel.
Well, we asked the question, what is the return on compliance? So actually all doctors have to comply to the, at this moment, European guidelines. Probably they will be translated into national guidelines. And the question is, how can we reimburse all these investments in quality?
3 speakers described the dose tracking requirements prescribed by Euratom and how data gathered to comply with its directives using Bayer's Radiometric software can be leveraged to benefit patients and healthcare providers. Dr. Reinhard Lohse of the Clinic Nuremberg in Germany described a case in which too much radiation not only exposed the patient to an excessive dose, but degraded the image quality. Lohse and his colleagues noticed and corrected the problem quickly, but there is no assurance that this will happen in every case.
You cannot do it, catch all these things with your eyes or manually. So a radio technician, if he's very well trained, would have seen, oh, the dose is 3 milliampere seconds and the patient is slim. And the radiologist looks at the image like me and sees, okay, it's dark in the middle, bright in the periphery, and we have striped, there is something going wrong. But that both is not automatically. It's relying on the human intelligence factor or something else.
This is where management tools come in. Dr. Sebastian Schindera of the University Hospital in Basel, Switzerland, explained how dose management tools improve the consistency of imaging exams and, consequently, the quality of exams while optimizing radiation dose to patients. Not only do they reduce variability in protocols, thereby increasing the reproducibility of high-quality results, and even alert physicians about patients who exceed a certain cumulative dose, for example, 100 millisieverts. These management tools allow practices to be compared to those of other institutions. This is especially important in CT, which has increased markedly over the past several decades and can expose patients to substantial radiation.
I think it's very important that you see over time how you're actually developing your CT unit. You have to have actually a baseline, and then over the time you have to compare how you are improving, and also important is to compare actually with other institutions.
Dose management tools can increase efficiency, said Dr. Marco Das of the Maastricht University Medical Center in the Netherlands. Bayer's Radiometrics has proven this at the Dutch center, he says, by minimizing patient wait time, balancing patient loads on various scanners, and reducing the number of repeat scans through increased consistency that minimizes contrast injection problems.
It has 3 important tools integrated, and one of them is the contrast media management tool, one other is the radiation dose tracking and monitoring tool, and the other one offers business intelligence where we can really monitor our daily efficiency and usage of our scanner equipment. And combining these 3 points, I think we can significantly increase the efficiency.
This is Greg Fryer for DI Europe at the European Congress of Radiology.